Hello, future real deal registered nurses. In this video, let's break down a different type of question that you might see on the Next Generation NCLEX. The question I'll walk through today pairs up pretty nicely with our pregnancy or maternity videos within our crash course. So if you haven't checked that out or you need a little extra content support, be sure to do that. Now, this question that we're going to go through today is an example of highlighting, and highlighting is included within the new enhanced hotspot NGN style questions. So to practice this skill, we're going to review a brief nurse's note together, and we're going to highlight the findings that might point you to a placental abruption. So first, what do we do with these types of questions? This is where you must select parts of the text to highlight as your answers. This could be within a table format. It might ask you to highlight a row of text within a list, or just select parts of a paragraph or chart like we're going to do today. And it can be a variety of things from highlighting what are the critical actions to highlighting what alarm signs and symptoms are noted. Really, I like to think of this as just a more interesting version of a select all that apply. With these on the exam software, as you hover over the text, pre-selectable text will appear, and you just simply have to click on which parts are or are not important to highlight them. Now, let's walk through how these questions are scored. For each component that you correctly highlight and select, you will receive 1 point. For each that were not correctly selected or were incorrect, you will have 1 point subtracted. Remember here, there is no NCLEX question that can deduct points from your overall score. So the lowest score you can ever receive for a question, even one of these, even if points have been subtracted, is 0. So on these types of questions, the maximum number of options is 10. Absolute worst case, you get 0 points. Best case, you get all of the points for those correct answers. All right, let's get to our practice. So for these samples, the bolded text within the nurse's note will act as a selectable text for you all, since you can't actually hover over the text in this video. So let's jump to it. The registered nurse is caring for a client in the labor and delivery triage following bright red vaginal bleeding at 36 weeks gestation. Read the following nurse's note and click to indicate findings that indicate the client is possibly experiencing a placental abruption. And here is our nursing note here. So I'll read it to you. So it is 1848. The client is admitted to triage at 1835 following a 90-minute history of bright red vaginal bleeding, and the patient rated 6 out of 10 sharp cramping abdominal pain. The client is experiencing uterine contractions every 5 minutes. She had just finished eating dinner when the pain began. She is alert and oriented ×4. She is grimacing and appears distressed. Her abdomen is tender to touch in all 4 quadrants, but her fundus is not firm nor rigid. New peripad was placed on the patient at 1835, and it is currently saturated with dark red blood. There are no clots noted within the vaginal bleeding, and her vital signs are as follows. Heart rate of 110, blood pressure is 114/63, temp is 98.3, and her SpO2 is 98%. The OB is currently at the bedside assessing the client. Okay, so here's what I want you to do. I want you to pause this video, and I want you to read these notes again. I'm going to give you a minute, pause it, take as long as you need to mentally make your choices. Then when you press play, I'm going to show you the answers highlighted. And here are some tips. Read what the question was asking you. Remember, we are selecting findings that could indicate a possible placental abruption. Reread the notes, click the associated findings. Then you want to reread the findings that you highlighted and ask yourself, does this make sense that this particular finding could indicate a placental abruption? All right, pause the video, make your selections, write them down, and press play when you are ready. All right, and here it is. So We have 90-minute history of bright red vaginal bleeding selected, 6 out of 10 sharp cramping abdominal pain, uterine contractions every 5 minutes, grimacing and appears distressed, abdomen tender to palpation in all 4 quadrants, peripad is currently saturated with dark red blood, and the heart rate highlighted. So let's talk this through. Remember, we're looking for findings that indicate an abruption. That 90-minute history of dark red vaginal bleeding and 6 out of 10 sharp abdominal cramping is textbook for this condition. We see here she's having uterine contractions at a 5-minute frequency, which can also happen in an abruption. And important to note here, an abruption frequently will occur in laboring patients. Now, a couple distractors. She just finished having dinner with her husband. Does that have anything to do with the onset of an abruption? Nope. She's awake, alert, oriented times 4. That's great news, right? Absolutely. But doesn't indicate an abruption. Now, if she had an altered level of consciousness, that could point to some excessive bleeding leading to poor perfusion. But we are not at that point yet, thankfully, so we're going to leave that choice out. Now, client is being assessed, tender abdomen to touch and grimacing and appears distressed. Do you think those happen with an abruption? Definitely. Okay, next one is interesting. Her fundus is not firm nor rigid. So sometimes you'll have distracting answer choices like this because not every client will present with 100% the same symptoms with the condition. We'd expect a firm fundus and an abruption, but we don't have one. That doesn't mean we'd absolutely rule out an abruption, so we definitely want to keep digging, but we're not going to select that answer. All right, her pad is saturated. What do you think about this one? Yeah, absolutely. A hallmark of abruption is dark red vaginal bleeding. And then we look at her vital signs here. And the only one we would consider abnormal at this point is that her heart rate is a little bit tachycardic. And that could be an indicator of blood loss. All right, my friends, see, that wasn't too bad. Do not let these different formats fluster you. Really think of this as a select all that apply, just with a different format. Follow us for more videos breaking down the question formats and some future larger case scenarios. Happy studying, my friends. You can do this.